Good morning. We have noticed a persistent drop in the number of people getting tested for COVID-19 in recent months. At the height of testing last year, the Department of Public Health was testing an average of 275 people per day. Last week, we averaged 25 tests per day. Unfortunately, this indicates that many of us may be experiencing a false sense of security. The truth is, more than 130 people contract COVID-19 every day in St. Louis County. While vaccinations continue to grow, the pandemic persists. If you experience any symptoms of COVID-19 or if you have been around someone who has tested positive, it's imperative to get tested. Our Department of Public Health offers free testing Monday through Friday at the John C. Murphy Health Center in Berkeley and the South County Health Center in Sunset Hills. To register for a free test, visit stlcorona.com and click on the testing tab. Symptoms of COVID-19 include a cough, fever, and difficulty breathing. If you are sick and you think you may have COVID-19, stay home until you can get tested. Some people should be especially alert for these symptoms, including those who have been in close contact with someone diagnosed with COVID-19 and those at high risk for poor outcomes, including people over 60, people with chronic medical conditions, and those who are immunosuppressed and those who are pregnant. Testing is one of the best tools we have in our battle to contain COVID-19. Earlier this week, Kansas City announced it would relax restrictions, including allowing restaurants and bars to operate at full capacity, provided mask guidelines are followed. Yesterday, the CDC said those who are fully vaccinated do not need to wear masks outside, and President Biden said the country is making great progress with vaccinations, with 2/3 of seniors fully vaccinated. But he cautioned, we have a long way to go. The easing of restrictions is made possible as more people get vaccinated, and I urge everyone to get vaccinated as quickly as possible. We have a walk-in vaccine clinic today at the Heights Community Center in Richmond Heights from 9 a.m. to noon. Tomorrow there is a walk-in clinic at Hayman Park Community Center in University City from 9 a.m. to noon. And on Friday, the Bridgeton Recreation Center will hold a walk-in vaccine clinic from 8 a.m. to 2 p.m. No appointments are necessary. Meanwhile, our Department of Public Health is working closely with the City of St. Louis Health Department to align our public health protocols, and we plan to jointly announce the next steps as early as Monday. Mayor Jones and I have committed to working closely together for the betterment of our region, and public health and the response to this pandemic is a great way to begin those efforts. And I'd be happy to answer any questions.
Dr. Page, we have a few questions today from Channel 4. Yesterday, the state of Illinois put out new mask guidance following the CDC's recommendations. When is St. Louis County expected to follow?
So the question is about the CDC new mask recommendations and St. Louis County's plans to follow those, and we certainly plan to adopt the CDC recommendations and incorporate those into our public health protocols, and we'll have an announcement soon.
You addressed this a little bit, but if you could answer this. When it comes to easing restrictions, local leaders have indicated decisions will be made jointly between the county and St. Louis City. Does that mean we will not see capacity restrictions loosened until the city's positivity rate is lowered?
So the question is about the alignment of St. Louis County and St. Louis City public health protocols and guidelines. They're actually very close at this point with some small variations. And as we move forward with relaxing our protocols, we're going to work very hard to keep these public health protocols and guidelines as closely aligned as possible. The positivity rate is one of the many variables that our public health experts look at when they make their recommendations. Public health or the positivity rate is affected by the number of tests being offered in our community, number of tests that are performed in our community. As it stands right now, the number of tests are lower than we'd like to see. So we encourage everyone who may have been around someone who is positive, or everyone who has symptoms, or everyone is concerned, to please get tested. We have plenty of tests in our community. We'd like to see more people getting tested.
If we could turn to evictions and the vote by the council last night. The emergency measure did not pass, and now the evictions won't be paused until May 12th. Can you help us understand the current situation for local residents and families?
So the question is about evictions in St. Louis County and the County Council's action last night. The County Council voted last night to implement the CDC moratorium on evictions, which is currently in place in our country. The County Council decided to add to that security of the CDC public health order and pass an ordinance here in St. Louis County, which I believe was an important step. And I thank the County Council for doing that. In order for that to go into effect immediately, it requires 5 votes to pass. Last night it passed the County Council with 4 votes. So there was a 15-day delay for that ordinance to go into effect. In the meantime, the CDC order is still in effect, which prevents evictions based on the tenant's inability to pay their rent. And that's an important, it's an important order, and it's an important ordinance because we have $30 million from the federal government to support and to pay for the rent for those families who need it and are threatened with eviction to make the landlords whole. And we're doing everything we can to get our landlords and our tenants aligned and through that application process so we can get that $30 million into the community and help landlords who have tenants who are behind in their rent and help tenants who are worried about paying their rent.
Dr. Page, you mentioned the applications. About how many people have applied for assistance through the ERAP program?
So we have about 2,000 applications that were pending from our recent CARES Act because we ran CARES allotment because we ran out of funds. And then we have over 2,000 applications that are being processed from the most recent federal allotment of $30 million. So almost 4,700 applications are now being processed for people in our community, and we're trying to keep them in their homes. It's a very important public health policy during a pandemic to prevent, whenever possible, prevent people from becoming homeless. It's a risk to them as an individual and their family members, but it's also a risk to our community in the middle of a pandemic.
And we got a question in from the Post-Dispatch about some of the council members and landlords have argued that the county doesn't have the ability to enforce this ordinance. Is that a concern of yours?
So the question is about enforcement of the county ordinance. These sort of constitutional questions are always raised in the middle of a political debate. What we heard and what I've heard from our county councilors is the ordinance is solid. It can be enforced. All of our ordinances, all of our orders surrounding the pandemic have been challenged over the past year. They have all stood the test in courts, and I believe that this ordinance will as well if it is tested. What we need to be doing is working together to get landlords and tenants matched with this emergency rental assistance program, keep people in their homes while we're matching them with this program. Unfortunately, the arrival of these funds and the expiration of the moratorium were not timed well, but the funds are in our community. We need to match landlords and tenants with this $30 million and keep tenants in their homes while we're doing that.
That's all I got. Thank you.
Okay, thank you.